Our studio guest is joining us this morning, and well, we're talking about a problem everybody experiences. Some people more than others, and sometimes some people experience it just because it's a part of a almost chronic that they have these things called headaches. Russell Singleton is joining us. He's a physician assistant from Trip Family Medicine here in Twin Falls, and joins us. We have well, Russell or one of the other medical pros joins us every Wednesday morning between 8:30 and 9 o'clock, right here on Top Story with Bill Colley on News Radio 1310 KLIX and News Radio 1310.com. We're at 35, just turning 8:34. And first of all, welcome back.
Thanks. Good to be here.
I was going to point out that a lot of people know the feeling of a headache, but when we're talking about headaches, there are multiple causes. You could smack it on the top of your car door. That's one. There's a tension headache. There's a headache you get if you've got the flu or a cold. Then there are the people, when I mentioned chronic, the migraine sufferers. I mean, there's any number of potential things we're talking about.
Yeah, and that's a pretty good introduction. I think just in that little paragraph, you've already kind of highlighted some of the different types of headaches. So today we'll talk about primary headache versus a secondary headache. We'll talk about some of those common secondary causes. I've got a couple of maybe, I don't want to say fun ones because they're certainly not fun to the people who suffer them, but they're certainly unusual types of secondary headache. But then we'll talk about primary headaches, and these are the things that we're probably all more familiar with: the tension headaches, the migraine headaches, etc. But this is a big deal, Bill. I think 80 to 90% of us, according to statistics, have had a significant headache at least once in our life, and probably half of us have had one in the last year.
And I was going to say you can often tell the type of headache by the location of it, right? I mean, sometimes you feel it in a particular spot in your head versus another.
Absolutely. I think with any complaint or medical condition, we try and get an appropriate history. There's an acronym that they teach medical students or PA students in school. Actually, there's several, but one I always try and remember is old CART. And when we're evaluating a pain complaint, certainly we start with O, onset. When did it start? L, location. Where is it? D is duration, and then we go on and on. Character. We talk about uh, is it a stabbing pain? Is it a dull aching pain? But you're absolutely right. These headache syndromes will often present in pretty unique and predictable locations.
When you talk about them too, there are often various treatments. But I had a coworker who she suffered from migraines, and when she was suffering from one, I mean, there was no productivity at all. She just couldn't function. I mean, it knocked her out for the duration of it, which could be sometimes hours.
Oh yeah, or days. I think if we were to calculate or report on lost productivity for headache syndrome, we'd be in the billions of dollars in this country alone. I was looking at some statistics from the World Health Organization, and they talk about um, disease years or disability years. And headache is, headaches in general is probably in the top three, but then any one of these particular headache conditions are probably in the top 10 all by themselves. So this is a big deal. And we lose productivity, we lose sleep. Chronic issues, like you mentioned, can bring on things like depression, and that creates a whole new set of symptoms to deal with.
Well, in talking a little bit about this, I know there are some people out there who probably, when they get a severe headache, almost wish they were dead. Is this part of the evolutionary biology process that we deal with this? I mean, is there something going on that because you would think that in our design we shouldn't be dealing with a lot of these things, but we do.
Yeah, that is a great question. There are a lot of headaches that we call secondary. So infection, I think you started to talk about this, but when you have the flu, oftentimes you have a headache along with your body aches and sore throat and cough. People get sinus headaches really frequently, and again, that's a secondary headache. It's a result of an infection. Another common infection would be meningitis. But there are some things that we do to ourselves that um, can cause significant headache issues. Hangovers, for example, if you drink too much, uh, side effects from other medications that are maybe trying to treat another condition. Having untreated high blood pressure can leave you with a chronic headache. But then one that I wanted to highlight specifically was the overuse of pain medication. So it's natural to have a couple of headaches, start take some aspirin or some ibuprofen. But then when it becomes a daily thing, you will have a rebound headache just because of the rapid cessation or withdrawal of the aspirin or the ibuprofen. And so we can talk about the organic causes a little bit later, but certainly there are some things that we're responsible for: stress, um, poor sleep, dehydration. The list goes on.
We've got to mention we've got a short break coming up. Russell Singleton joining us in studio this morning from Trip Family Medicine right here in Twin Falls on Fillmore Street, directly across from the main post office. We'll talk more a little bit later in the show about contact information. Also, I do want to point out, too, if this is a subject that is close to you and you're suffering from issues with headaches and you'd like to get a couple of questions in this morning, following the break, feel free to call us. Telephone number 736-0300, 736-0300. Bill Colley with you as well this morning on News Radio 1310 KLIX and newsradio1310.com. Our studio guest is Russell Singleton. He's a physician assistant at Trip Family Medicine here in Twin Falls. And we should point out for people who would like to get in touch with the office, some easy ways to do that.
Yeah, call us at 933-4400. Call early. We will get you in probably the same day. I have to say, I believe I'm holding down the fort again, all by myself. The other two providers are doing some training today, so you better call early today.
We were talking about headaches this morning, and if you've got a question or comment, and maybe you're looking for a remedy, feel free to give us a telephone call at 736-0300. That's 736-0300. We're at 844. We're at 38 as well. On our way maybe to 70 today in some areas. Bill Colley with you as well on News Radio 1310 KLIX and newsradio1310.com. I've never been a big headache sufferer, but when the weather changes sometimes and there's a change in that barometric pressure, then I feel it. And that's usually related to sinus, right?
Well, I think that is a good segue into talking about the infamous brain freeze, the infamous ice cream headache.
Mm-hmm.
And I should probably begin by saying that I don't know that we fully understand the etiology or the cause or the pathophysiology behind any of these conditions. If you look at migraine alone over the last 10, 20, 30 years, our theories have changed. We first believed that it was vascular, that it had to do with either the constriction or the dilation of vessels or the alternating between the two. Then we thought, well, it's neurotransmitters, the levels of dopamine, serotonin, norepinephrine. Now, the prevailing theory for migraine is this hyper neuronal excitability that your brain cells are just really sensitive to stimuli. But that change in pressure or change in temperature is interesting because that's really all an ice cream headache is. It's just that rapid drop in temperature. It irritates those, or at least it affects those nerves at the roof of the mouth. And as soon as it warms back up, I think those impulses change or the blood vessels can expand again and it tends to go away.
Very temporary.
Yeah, but very painful for those first few seconds, I
Yeah,
should add.
that was. I have experienced that sometimes with a big glass of ice water as well. I mean, it just very quickly hits you, and then you've got to stop, put the drink down, and wait for things to sort of reach equilibrium.
Yeah, and so sometimes you can improve that by just kind of rubbing the top of your mouth with your thumb or with your tongue to try and warm it back up. But I have people tell me that they'll get it when they swim, when they dive into cold water. Just that sudden change of temperature in the head and neck area is enough to trigger 2 to 3 second really painful headache.
There are sometimes I think some fairly simple treatments. I remember when I was 20 some years ago working at a TV station, and I walked into the office one day, and I had a desk I shared. It was like a sort of what they would do is they connect desks together, and I shared it with David Muir, who I don't know whatever became of him, but he handed me this device. He said, "We just got this in. We're testing it." He said, "Try it out." It was called the Tingler, and it was this thing that had like these big metal fingers on it, spring-loaded fingers, and you pull it, and it would massage your head. And according to what he was telling me, people claimed it helped reduce some of the stress and tension headaches people get.
Yeah, that is a good experience to talk about. So I think that speaks toward one of the most common types of headache, a tension headache, which is caused by stress. It's caused by physical exertion or muscle fatigue. Sometimes just by the way you sleep or by your posture. But it's very much a soft tissue headache in this case, where there is some tightening of the muscle of the fascia. There's some irritability, some contracture, and probably some lactic acid buildup. And massage can help release that. Dr. Tripp is great at this. He does that OMT, osteopathic. I think it's manipulative therapy or manual manipulation. But I've done that before. Jeremy's done that before, and it's just by trying to loosen up fascia, loosen up muscle, change blood flow, and if you have a device that can kind of do that for you, I say go for it.
They were fairly common on late night TV where they were selling them, and then all of a sudden the fad ended and it was over with. But I remember thinking it was a good tool in that situation.
Yeah, so anything that is going to be more of a massager, essentially, I think is probably a good bet for a tension headache. I would caution listeners about some of the devices that are maybe a little bit more out there, and I'm sure there are some listeners who would disagree, and you're welcome to call and share your opinion. But there's a lot of folks who claim that magnets will help, and I guess in the end, if you feel better, that's great, go for it.
So
But
would a hand crank drill and letting the bad humors out of your
that's
body.
that's true. That's true. I had a patient tell me one time that she got her ear pierced with a little, I don't know if it was a copper rod or whatever it was, but her neurologist told her to do this, and she swears by it. She hasn't had a migraine in the few weeks that she's had it, and I can't say I had ever heard of that. Um, I mentioned it to Jeremy, and actually he had heard of it, but but she feels better, and it's medication free. She's not having any side effects. So there are some of these other things out there that, maybe if you've tried everything and you've been to your primary care provider, you've been to a specialist, and you have nothing else to lose, that's fine, but I wouldn't necessarily start there.
We're about 10 minutes away from 9 o'clock this morning. We're joined by Russell Singleton. He's a physician assistant from Tripp Family Medicine here in Twin Falls. We're at 39. Bill Colley with you as well on News Radio 1310 KLIX. You referenced medication. For migraine sufferers, I guess that's the last, if nothing else works, you get into that.
Well, that is a good point too. I like the way we're going here because I wanted to end talking about migraine, and if nothing else, at least make the distinction that while all migraines are headaches, not all headaches are migraines. I think there's a misunderstanding as to what a migraine really is. And even though there is some overlap, not only in the symptoms, but the treatment of headache disorders, migraine is probably the one everyone thinks of. So, real quick, there's two different types of migraines. There's a classic migraine, and then there's a common migraine. The classic migraine, people usually get aura. So they get flashing lights, they get squiggly lines, blurred vision. Sometimes they'll get other weird, what we call paresthesias, numbness, tingling. The common migraine doesn't have any of that, but then they both share the unilateral, one-sided, pulsating headache, sensitivity to light, sensitivity to sound, nausea, severe pain, and all these people can do is lie in a dark room for sometimes a day, 2 days, or 3 days. And that particular headache disorder has a very specific type of treatment, and yes, medication is part of that.
That helps with the constriction, which is really what's causing these, right? The blood vessels.
Well, again, I think the prevailing theory now, at this time, is probably that neuronal hyperexcitability. So we're looking at medications that affect the way nerves fire. Some of the common prevention or migraine prevention medications that I'll use were originally designed as seizure medicines, and they affect sodium channels in the way nerves fire. Um, the most common, what we call abortive treatment, so acute treatment for a migraine, is probably what's called a triptan, like a sumatriptan or rizatriptan. And even those don't tend to help all people all the time.
When we talk a little bit about, the treatment of all of this and the like, uh, even with a migraine, it eventually will pass. You mentioned they can go on for days at a time. For those people who deal with that, there has to be because we don't know it maybe as discrimination, but if you have an employee who is suffering through that, From an employer standpoint, this is it a legitimate medical excuse, I guess,
Yeah.
for someone to use at work? Because how would you know as an employer if that person is being straight with you or not?
That is a great question. And as an employer, you really don't. And to be quite honest, as a practitioner, even we don't always know. I mean, a patient can come in and say, "Yeah, I get debilitating headaches to where I can't move for days." And what do we say to that except, "Wow, I'm sorry." So a patient in that particular case probably needs to come talk to us. That we need to have some history. We need to try some things, do some testing. But then ultimately, besides finding the right treatment, I think the key there is probably getting um, the FMLA paperwork filled out, the Family Medical Leave Act, where we can inform your employer that once a month or once every 3 months or once a week, whatever it is, you have this legitimate medical condition that we are trying to treat and that they should recognize as a real serious thing. And as an employer, I would hope that they're sensitive to that. And again, back on the employee, hopefully you're a good enough, productive enough employee to where you've earned some of that goodwill.
I walked by a television set last week and I was in a hurry and I heard somebody on TV say that there was a new hangover cure that was being marketed, probably in college towns, but being marketed that this thing would help people get out of a hangover if they woke up in the morning. First of all, I guess the best way to avoid those is not to get drunk in the first place. But are you confident that people out there are doing anybody a service by selling this as an antidote?
Good question, and I agree with you. I think the best prevention for any type of headache, migraines specifically, is to identify your trigger and avoid them. And obviously, in hangover, it's excessive alcohol. Alcohol is very, very um, drying or dehydrating. And so I think what people are really doing, if you and I are thinking of the same thing, is that they're replacing fluids. There's services. I think in Las Vegas, there's a mobile service that goes around and he'll come to your hotel room and he'll put an IV in your arm and he'll give you a liter of normal saline and maybe he'll give you some B12 and some magnesium, some other things that could help, maybe a little bit floofy. But I think it's the rehydration that actually can have a pretty decent effect on recovery.
I had to add to this when you talked about the woman getting her ears pierced with a copper. When I was a kid and I would get hiccups now and then, I'll never forget my dad took me to the kitchen one time, put some water in a glass, and then he took a butter knife out and he dropped the business end of it face down into the water so that just the handle was sticking out. And he had me tip that glass up, but the handle went right above the bridge of my nose between my eyebrows, and I drank the water with that pressing against that, and my hiccups went away. Now, he told me that I had depressed a nerve that did it, but I think it was probably in my head. But for some reason, it seemed to do the trick. At least I've never tried to repeat it, so I don't know if it was just one of those lucky moments. Um, but sometimes just thinking you're better can be a turnaround.
Yeah, I think that's very true. In the case of this dear patient, she had tried everything, and bless her heart, she finally found some relief, and I am absolutely happy for her. But your experience reminds me of something my grandfather and mother would tell me and do to me. They'd have you hold your arms out, and they'd try and press them down, and then they'd put a little pinch of sugar on your tongue. And lo and behold, you wouldn't be able to exert the same type of strength, and they just within 10, 20 seconds, and they use that to say sugar is bad for you. I still don't exactly know what was going on then. I have witnessed it myself, and there probably is some power of suggestion there.
There was a time I can recall when in my neighborhood as a kid, and little boys sometimes have problems wetting the bed. So a group of women sitting around my mother's kitchen, one of them claimed that if you sat a child down in a bath filled with ice water, that would bring it to an end. And unfortunately, there was a lot of child abuse in the neighborhood that week after that was done. But people tend to buy into some of these crackpot theories, and it happens. Sometimes they're not dangerous, but sometimes they can be.
Yeah, and honestly, I'll take some blame for that because I think patients feel like either they're not understood or they're not taken seriously or they're just not getting the type of care or results that they want. So I know I can do better and want to do better. Just making patients know helping them understand that what they're feeling is real and it has a real effect, a lasting effect on their life, and that I'm dedicated to helping them. I think if patients can feel like someone is on their side, they might be a little bit less likely to feel like they're gonna have to grasp at whatever straw and go down whatever rabbit hole is available to them.
Well, we want to point out if people need to get in touch with you, they can do it at the office. We've got to wrap up, but number of ways to contact Trip Family Medicine.
Yeah, check us out on Facebook, on Twitter. I think if we don't yet have an Instagram up, we're thinking about that. We're getting ready for that. And just one last plug for our Peel party this month. Come find out what that's all about. But it's a very exclusive event, so you want to be there first and take part in that.
What day is that again?
I believe it is the 24th, and I'm going to be in big trouble if that's not right.
That would be a Monday.
Okay, so it's not. It's on a Wednesday. I believe it's the all right. It's got to be the 26th then. Yeah, Wednesday the 26th for sure. That is confirmed.
All right. I knew that it was a Monday because my sister's birthday is next Monday. It's the 17th. So a week following that is the 24th,
You
which
just
means your day's the 26th.
you just got me out of some hot water, Bill. Thanks.
Beats that cold water treatment. We've got a break on the way in just a few minutes for Fox News. One more hour of Top Story is just ahead. And we're at 39.